Hello beautiful nurses, it is another beautiful day. You are welcome back to Unified Husky YouTube channel, where we make Husky very simple for everyone. And today I'm going to be presenting another skills in Husky, which is administration of subcutaneous injection. Administration of subcutaneous injection. And I'm going to start straight away, but before then, please don't forget, in order for you to encourage us to upload more videos, please kindly click the like button, click the subscribe button, and you can as well leave your comments. More so, please, after watching the video, you will do us well by sharing the video with other professional colleagues. Thank you very much. I'm going to start the demonstration straight away. I ensure that the room is safe as I approach my patients. I try to provide privacy by drawing the curtain. Then I perform my hand hygiene following WHO standard of hand hygiene technique. I'm going to apply an ample of gel on my hand. I rub my hand palm to the back of my hands with fingers interlaced, palm to palm with fingers interlaced, back of the fingers with fingers interlocked, tips of the fingers, rotation of the thumb and my wrist. I wait for my hand to dry for 30 seconds and I approach my patients. Remember, this is also a community scenario, so there is no wristband and there is no allergy band. And I will be following NAP, NAP. That is the acronym for administration of medication. So I will be following NAP, and it must be done twice. The N stands for the name with the date of birth. The A stands for allergy that I need to confirm from my patient. The P stands for pain. So I'm going to start now. Hello, I'm one of the nurses, the community nurse sent here today to come and give you your due subcutaneous injection. Can you please tell me your full name and your date of birth as I cross-check with what I have on my documents here?
My name is James Bond.
Your date of birth, please.
10/10/1940.
All right, I've confirmed I'm with the right patient, James Bond, with date of birth 10/10/1940, and your address is 1 Bond Street, London. Is that correct?
Yes, nurse.
All right, thank you very much. Is it all right if I call you James, love?
Okay, nurse.
All right. So, James, have you got any allergy?
No, nurse.
All right, good to hear. I can see that there is no documentation of allergy here as well. Are you in pain at the moment, love?
I'm okay, nurse.
All right. Is this position okay for you?
It's fine.
All right. So, James, I'm actually here today to administer to you, as I said earlier, your due subcutaneous injection, which is insulin glargine, and you are due for it now at 800 hours. Is it okay, James, if I go through the prescription chart with you?
It's okay, nurse.
All right. I have the prescription chart for James Bond, 1 Bond Street, London, NN72AL, with date of birth 10/10/1940. The medication is insulin glargine. The dose is 14 international units, and you are due for it today at 800 hours. There is prescriber signature there, which is Dr. WHO. That's the name of your GP, and there is no signature, there is no date and time across it, so it means it has not been given to you. And I can see that this is legal and legible, and I'm happy to administer it to you. Insulin glargine, James, is actually the medication that is used to control diabetes mellitus, to control your sugar level. So insulin glargine is given to keep your sugar level at check, to control your sugar level, and you are due to have another one now. It has its own side effects. You might experience it and you might not experience it. One of the likely side effects is that you may experience a kind of sweating, and you may experience dizziness, and you might not experience any. However, I'm going to be here for the next 30 minutes after administering it to you, just to check if you will experience any of these things. So you don't really need to worry yourself, okay? Assessor, please, can you confirm to me my patient's blood sugar level?
It's okay.
All right, it's normal. Then I'm happy to administer it to you. So, James, I'm going to step aside now to prepare the medication, the injection, and I'll be back shortly. In case you have any concern, just give me a shout and I will be here as soon as I can, okay?
Okay, nurse.
All right, love, thank you. As I leave my patient's side, I perform my hand hygiene again. You must always ensure that you don't miss any of the steps, the 7 steps of the hand hygiene. Then the first thing I'm going to do is to put on my apron so that I don't forget to wear apron at the end of the day. I'm putting on my apron. Assessor, can you please confirm to me that this tray has been washed with soap and water within the last 24 hours?
Yes, it is.
All right, thank you. So it is safe for me to use. I'm going to perform my hand hygiene again, and I will be putting on my gloves in order to clean the tray again with alcohol wipes. So I'm putting on my gloves. Now I'm going to take one of the alcohol wipes to clean my tray. I open the wipes and I wipe my tray, wipe the inside, I wipe the outside, and I'm going to trash this inside the clinical waste bin. Now I'm going to assemble everything I feel I'm going to use. I'm going to need in administering insulin glargine, that is subcutaneous injection. I'm going to need the insulin syringe. This is insulin syringe. It is intact and it is Indian. The expiry date is 2025. I'm happy to use it, so I'm putting it in my tray. I'm going to need 2 alcohol wipes, which is intact and Indian as well. Expiry date is 2027. I'm happy to use it. I'm putting that in my tray. And I'm going to need pair of gloves. It's always advisable that you go with extra gloves. You will be using 1 pair, but it's advisable that you go with an extra glove. So I'm going to be putting 2 pair of gloves inside my tray. And I will be needing 2 pieces of gauze, which is intact and intact as well. I'm putting that in my tray. I'm going to need the insulin glargine itself. This is my insulin glargine, batch number 34567. Expiry date is 2025. I can see that there's no precipitate in it, so it is safe for me to use. I put it in my tray as well. And that is all I will be needing for the administration of the subcutaneous injection. Before I go to my patient side, I must prepare the medication, the injection, before I go to my patient side. So the first thing I'm going to do now is to take my cleaner, one of the cleaner wipes, and I'm going to be cleaning the peak part of the injection. I open it. So I'm going to be cleaning the peak parts of the injection, the top, for 30 seconds, and I'm going to allow it to dry for 30 seconds. Assuming 30 seconds has passed, I drop it. Then I get my insulin syringe. I open my insulin syringe now, and I'm going to withdraw 14 international units as per documentation. So I remove the cover, I drop it in the tray while I puncture with my insulin syringe and needle to withdraw 14 international units. So I have with me 14 international units of insulin glargine. It is only in subcutaneous injection after cleaning the peak part that you are going to puncture. If it is intramuscular injection, you have to break the ampoule. So I'm putting this back now, and before I prime, I'm going to recap my needle first. I'm still going to show us again how to recap, the best way to recap the needle. Always remember that the cover needs to be at the corner. The cover of the needle must be at the corner of the tray. It will be very easy for you to recap if it is at any of the corner. Now I'm going to recap. It is already at one corner, so I can now press it down just a little. Alright, so remember, the injection must always go with you to your patient side. So I'm putting it back inside the tray. I have now inside my tray the injection that I've already withdrawn, and I can prime it now. Yes, I have 14 international units. Assessor, can you please confirm to me that this injection is 14 international units.
Yes, it is.
Thank you. So I'm putting it in my tray. I still have my gloves. I have one more cleaner wipes inside my tray, and I have the pieces of gauze. Now I'm going to discard all the rubbish that I've used with my gloves. I'm going to remove my gloves and I'm going to discard it inside the clinical waste bin. I perform my hand hygiene again. Assessor, I'm happy to continue with my apron because it is not visibly soiled. So I move back to my patient's side. Hello James, I'm back. Are you still happy for me to administer the injection to you?
Yes, nurse.
All right, thank you very much, James. Before I go on, can you please confirm to me, this is the second time that nap is needed, and it must not be forgotten, please. Before you administer the medication, you must do your nap again. So James, can you please confirm to me again your full name and your date of birth as I cross check with what I have on my documents here?
My name is James Bond.
Date of birth?
10/10/1940.
Thank you. And it is documented that you don't have any allergy. Is that correct?
Correct, nurse.
All right. Thank you very much. Are you in pain? Are you comfortable at the moment?
I'm okay, nurse.
All right. That's fine. So, James, have you had this injection before?
Yes, nurse.
All right. Can you remember the site that was used to administer the injection to you?
The left arm.
Oh, okay. The left.
left arm.
All right. Thank you. So, is it okay if I give it to you on your right arm?
Okay, nurse.
All right, so I perform my hand hygiene again and I have a quick check at the arm. I'm just going to quickly examine the arm. I can see that the arm is not swollen. There is no sign of inflammation or infection. I'm happy to use the site. I perform my hand hygiene again, and I need to ensure again that privacy is actually provided. I can see that privacy is provided for my patients. Then I put on my gloves. So James, I'm going to clean your right arm that I'm going to administer the injection through. I will be cleaning it for 30 seconds and I will allow you to dry for 30 seconds, all right?
Yes, nurse.
Okay, so I'm cleaning now for 30 seconds. Assuming 30 seconds has passed, I'm going to wait for it to dry for 30 seconds. Assuming 30 seconds have passed as well, I get my injection, remove the cover, and I'm going to pinch your skin. I'm pinching your skin now, and I'll be inserting the needle at angle 90 degrees. Can you breathe in for me, please? And breathe out. Thank you. I insert the needle, and I am going to give the injection within 10 seconds using the push and the pulse technique. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. I'm leaving it in place for another 10 seconds to allow maximum absorption of the injection. Assuming 10 seconds have passed, I'm taking it off now, and I'm going to put the dry gauze, just a gentle pressure without massaging the sites, and I'm going to activate my safety lock. I've activated the safety lock, and I'm going to discard it inside the sharp box. I'm just improvising for sharp box here, so I'm discarding it inside the sharp box. All right, James, that is all. I can see that the site is not bleeding, and I will be leaving you for now, James, to quickly go and discard my rubbish, as well as to document what I have administered to you. In case you have any, I will be back in the next 30 minutes to check on you, please. But in case you have any concern before then, while I'm doing my documentation, just give me a shout, okay?
Yes, nurse.
All right, so I step aside from my patient, and I'm going to document. I remove my gloves. I remove my gloves. I perform my hand hygiene again, and I'm going to document what I've given my patients. I'm going to put my signature, the date, the time, and I check the vial again. If there is a space to write the batch number, I'm going to put down the batch number. If I'm required to put the expiry date there, I'm going to put the expiry date of the medication on it as well. Then I will ensure that I restore the remaining injection as per manufacturer instruction. Then I'm going to discard all my rubbish inside the clinical waste bin, and I will ensure I'm going to discard all inside the clinical waste bin, and I'm going to ensure that I clean. You just verbalize again that I'm going to ensure that I clean my tray the way I met it in preparation for the next use. Then I perform my hand hygiene again. If there is still time, I go back to my patient. Assuming it is 30 minutes time, I go back to my patient. Hello, James, I'm back. How are you feeling? Are you all right?
I'm okay, nurse.
All right, James. So I'm going to be leaving you for now. In case you have any question or concern, I believe you have your GP number with you, right?
Yes, nurse.
Okay, just ring your GP, and if you feel it's a case of an emergency, you just ring 111 or 999. So I'll be leaving you for now. Thank you very much for your participation.
Thank you,
and that is the end of the procedure. So my professional colleague, thank you very much for watching. It is as simple as that. Administration of subcutaneous injection, it is as simple as that. One more thing I did not remember is that when I went to discard all my rubbish, I was actually supposed to remove my apron as well immediately. It's supposed to be part of the things I was meant to discard. So that is all about subcutaneous injection. Just keep practicing. The secret to husky is to practice and practice and practice, and you will be fine. Thank you very much for watching. So please don't forget, click the like button, share the video, click the subscribe button, and I hope to see you next time. Thank you very much. Bye for now.